this video, we are going to talk about assisted reproductive technologies. Inability to conceive or to become pregnant is called infertility. It is also called as sterility. There are many causes for infertility. It can be physical, it can be congenital, that is by birth, or it can be due to certain diseases or by the usage of drugs. It can also be immunological or even psychological. The problems of infertility can be seen both in male and female. Infertility can be widely classified into two types. As primary infertility, it is a condition where fertilization or conception never occurs, whereas a secondary infertility is a condition where a woman fails to conceive after having a child. That is, a second child may not happen. First, let us discuss about the causes of male infertility. One of the conditions is azoospermia. It is a condition where the sperms are absent in the semen. Oligospermia is a condition where sperms are found in very low count in the semen. About 90% of male infertility is due to this low sperm counts. Cryptorchidism is a condition where the testis does not descend down to the scrotum, that is outer to the abdomen. Asthenospermia is a condition where non-motile sperms are found in the semen. Necrospermia is a condition where dead sperms are found in the semen. Teratospermia is a condition where abnormal sperms are found in the semen. It can be found with two heads or two tails or even many other abnormalities. Impotence is the inability of a male to hold an erection of penis long enough for a normal sexual intercourse. That is, the penis do not remain erect long enough. Sterility can even occur due to sexually transmitted diseases, STDs, or even due to the surgical removal of testis, which is called as castration, or even due to the hyposecretion, that is less secretion of the male hormones. Now let us discuss the causes of female infertility. Female infertility can occur due to the damage or blockage of oviducts, that is the fallopian tube. Sometimes it can be due to the damage in the uterus due to various reasons. It can be even due to sexually transmitted diseases. Sometimes it can be due to underdeveloped uterus, tumors in the uterus, or even due to the hyposecretion, that is less secretion of female hormone. The remedial methods to infertility or the methods to treat infertility are called assisted reproductive technologies. Some of the important assisted reproductive technologies are in vitro fertilization and embryo transfer. In this method, the fertilization occurs outside the body. That is, ova from the wife or a donor and sperm from husband or another donor are collected and induced to form zygote in the laboratory conditions. The zygote so formed in the early embryo stage, that is up to 8 blastomeres, it is transferred into the fallopian tube, where the further development takes inside the mother's body. And this kind of transfer of zygote or early embryo into the fallopian tube is called ZIFT, zygote intrafallopian transfer. Sometimes embryo with more than 8 blastomeres is transferred and it is done into the uterus for implantation. And this method is called as intrauterine transfer. If it is transferred to the uterus directly, then we call it as intrauterine transfer or IUT. Now the baby born through these IVF ET technology is called as test tube baby. Yet another treatment is called GIFT. Here the gametes, that is ovum collected from the donor, is transferred into the fallopian tube of another female who cannot produce the ovum. So here gamete is transferred into the fallopian tube and hence it is called as gamete intrafallopian transfer. The recipient, person who receives, the recipient female can provide suitable environment for fertilization and further development. Sometimes the sperm is forcefully injected into the cytoplasm of the ovum and this is called as intracytoplasmic sperm injection. The major difference between IVF and ICSI is that in IVF, ovum is left for free sperm integration. That is, many number of sperms are allowed to fertilize and out of that, one sperm gets fertilized. Whereas in ICSI, forcefully one sperm is let or injected into the cytoplasm. In fact, both are in vitro technologies which is happening outside the body of the female. After ICSI, either ZIFT or embryo transfer technique is followed. That is, either the zygote is transferred to the fallopian or in the embryonal stage it is implanted into the uterus. Artificial insemination is a method in which semen of a male husband or a donor is introduced into the vagina or uterus of the female. And if it is introduced into the uterus, and we call it as intrauterine insemination. Mostly, this technique is followed due to the inability of the male partner to inseminate the female, or which we call as impotence, or even due to very low sperm count in the ejaculate, or we call that condition as oligospermia.